Okay, I'm Ruth, and this is the Bethel Center on the Oasis Foundation. It started off as a clinic for the neighborhood, but then up the road in Maidemu, the government has a clinic. It was a clinic actually that Sister Karen built. They decided to develop it into a bigger center, so we decided to close this down as a health post and to use it as a special center for fistula patients. The fistula patients are women with childbirth injuries. They have severe injuries after their delivery, during delivery, when the baby gets stuck in the pelvis, and afterwards they leak body waste continuously. So we look after these women. The hospitals don't like to look after them, so we look after them and send them to Addis Ababa or to Makali, where they can be operated on. We also have a center here for women and men that are HIV/AIDS positive, people living with AIDS, and we give them nutritional support. So we help them with food. The local government hospital gives them good treatment, good medical treatment, but many of them stop taking the treatment because they get very tired, and because they're tired, they stop the treatment. So we have a problem. So what we do is we give them soya and sugar so they have supplementary protein food. Now I'll show you around here. We have the toilets for the patients and the visitors, and then we have one for the staff, and there's a little kitchen area here, and this is the room of Ethiopia. We can go in and I'll see if Ethiopia's here. Alec, Ethiopia? Yellow. Okay, Ethiopia's not here, but we have Meheret. Is she salam nagarich? Is she? Nagare video. Salam.
Salam.
Salam. So she's shy. Meheret is our one of our students, and school was not good for her, and so she's now working with Ethiopia, and she's very shy. And this is where Ethiopia and Meheret live, and they have a very good friendship. And so Ethiopia is training her how to cook. But Ethiopia is in charge of counseling the people living with AIDS. Ethiopia herself has AIDS, and she accepts it. It's not a problem, and she supports other people that have AIDS. And she's out just now. In this corner is where Letish and Berhin live, so they're always on duty. And then we've got Berhin in the office. Is she? Berhin, do you want to say hello to the people in Italy? Just say hello to the camera.
Good afternoon.
My name is?
My name is Berhin.
Okay. And Berhin is what we call a health extension worker. The Minister of Health decided to do a training for women, 30,000 women that have completed 10th grade, and they train for 1 year. They train them for 1 year in different places around the country. And so Berhin was trained, and she just finished, and their principal role is to educate the population in good health practices. We specifically do health education in maternal health matters, the care of the mother and the baby. And we also give out simple delivery kits. Maybe you could show us one of your simple delivery kits, just to show you the samples. These are kits that we take for another project, which is people that are sick with a liver disease that we have to help. But the simple delivery kits, the simple delivery kits are sheets of plastic, and we have cord clamps for clamping the baby's cord at delivery. There's a piece of soap so that the attendant can wash her hands. There are gloves, there's swabs, and there's a big plastic sheet that goes under the mother so that we can do a clean delivery. So we do clean delivery kit distribution, we do maternal health education, We do care of the fistula patient. We do support of the HIV/AIDS patients, the people living with AIDS. We support them with food. That's basically what we're doing, and I'll show you our little ward where we have the fistula patients. This is the ward for the fistula patients, and they have 4 beds in here and 2 beds here. Sometimes we can have up to 7 patients, and if we have 7, then we have to put 2 in 1 bed. And then what we do is we send them to Makali. In Makali they check them, and if need be, they then send them on to Addis Ababa. At the moment, we don't have any ladies here. But on Tuesday or Wednesday, the day after you arrived, I went up to Shiraro, and there I was able to examine 11 patients that they thought had fistulas, but they didn't have fistulas, they had uterine prolapse, so I was able to help those women. And so we sometimes get other women that come that we help as well. So this is our health area. And we also help the people living with this unknown liver disease, and we estimate that there are probably 10,000 people at risk. And Letish is just here. If she walks in, you can meet her. Come in, Letish. Letish is our nurse in charge, and she's in charge of the Bethel Center, and she does the care also of all the children in Grace Village. This morning when I went round, I found that Jonas, the little boy that has hydrocephaly, had a fever, and so we started him on some antibiotics and anti-fever medicine. I don't know.
Yes. Yes.
He's better.
Yes, so I will go now.
Okay, she's going to go and check on him just now. Do you want to say hello to the people in Italy? Just look in the camera and tell them hello. Just say, hello, my name is...
Hello, my name is Sister Letish. I live in Grace Village with Sister Ruth and Sister Karen.
There we go. Thank you. The mothers, and all the mothers except for 1 or 2, are also vulnerable. Some of them have had babies that died. Some of them can never have babies. Some of them will never get married. Some of them have AIDS, but you don't know which is which, but they have a lot of love for the children. So we have some wonderful women here looking after our children. So we'll go and see some of them as they go to school now. And then she has to go. Did you see kindergarten the other day? So we'll go to kindergarten as well. Yetenishli Georgia.